Welcome to the Empowered Parenting Podcast. I'm Kelly, and today we have a special guest, Dr. Rachael Kuperus. Dr. Rachael is a board-certified chiropractor and founder of Kuperus Family Chiropractic. With advanced training in pediatric and maternal care, she supports families from the very beginning, offering gentle nervous system-based care for babies, children, parents, and grandparents alike. She holds a diplomate in clinical chiropractic pediatrics and has spent years educating her community on how to support bonding, feeding, and development through nervous system regulation. Dr. Rachael is passionate about helping parents feel empowered through education, confident in their choices, and supported in their journey, especially during the early, tender stages of parenthood. She's a published author, a national lecturer on pediatric and maternal chiropractic care, and a mother of 2 young kids, bringing both expertise and empathy to every family she serves. So thank you so much. I'm so glad that you're on the show today.
Oh,
Dr.
thank you for
Rachael.
inviting me, Kelly.
What inspired you to pursue a career in chiropractic care, and how did your early experiences influence your path?
Yeah, so I played a lot of sports growing up, and I was constantly injuring my body, injuring my back, and I can tell you one specific time when I fell and I got a stress fracture in my sacrum and in my tailbone, and my mom took me to a chiropractor, and it was like a amazing experience. I hadn't been able to sit properly for a week, and I was adjusted, and I got under chiropractic care, and it really changed my ability to play sports, and it honestly helped my back feel better. And it was kind of an eye-opening experience because it was, I went to the chiropractor and they were able to help me after one visit, whereas I had been the medical community would just, basically tell me just rest and it would get better. It was someone that could actually do something to help me, and that was a really great experience that really kind of opened my eyes to chiropractic care. I also babysat for a chiropractor. Both her and her husband were chiropractors when I was in high school, and babysitting for them and seeing how their kids were growing up and how different their lifestyle was awesome. And she became a huge mentor to me as I went through school, and she really encouraged me to pursue chiropractic. And then eventually she's kind of the reason that I pursued pediatrics and got so focused in pediatrics and family care as well. I would say that is that specific example. And then just, being mentored by the right people as I went through my learning experience was a huge benefit for me.
Yeah, knowing the right people at the right time really influences where your life path
it's
goes.
amazing how, just meeting the right person at the right time in your life can really change things for you. So, yeah.
You mentioned how different their life was. What do you mean by that?
I mean, she adjusted her kids, how much healthier they were, how just I would say they were a chiropractic lifestyle family. So, the crunchy world has come so far in the past 10 years. Like, I feel like we're a lot more aware of so many things just from a healthcare standpoint and like a holistic lifestyle. But I don't want to make sound too old, but back then it wasn't as common to, be aware of like red food dyes and giving your kids organic foods. So I would say that was just something that went along with how they lived their life. And I started to, dive deeper into that as I, continued my journey on learning about health and wellness. And I would say that was, just seeing those types of things in a family was eye-opening.
Yeah, that's one of the things I love about chiropractic care is it treats the whole person and not just your.
Absolutely.
You've worked with parents of all ages, from newborns to grandparents. What led you to focus so much support on the entire family unit?
Yeah, so when I graduated from chiropractic school, I spent 3.5 years doing my board certification in pediatrics. So I did 3 additional years just in pediatrics. That was the only population that I saw. And after I was done with that, I just missed seeing the whole family unit. And I think chiropractic care plays such a benefit in the whole family. And it's not just, treating one member of a family. I see the family as a unit. So when one family member is struggling, often the rest of the family is struggling. You can think of, a colicky baby is affecting a 2-year-old that is like, my life just got turned upside down and I'm having a lot of stress in my body too. We focus so much on baby and mom, but that can be stressful for grandma too, to see, their child struggling with a newborn. So I would say, I see every member of the family. I think there's a huge benefit to full family chiropractic care. And I missed seeing that in practice, just seeing infants and babies and kids. So now my practice is full family. I do see a lot of pediatric patients, but I see just as many moms and dads and grandma and grandpa as well.
Yeah, it's just like chiropractic treats the whole body, and then it treat the whole family,
Absolutely.
right? Because when one part is having an issue, it's not just an isolated issue. It bleeds into every other aspect of life.
For sure. And the family is a unit. Like I said, when one member's struggling, everyone is going to be struggling. So yeah.
Define empowerment when it comes to making healthy decisions, especially for parents navigating care for their children.
So I would say empowered to me. When you look at a parent and you look at a child, I think nature put that specific child with that specific parent for a reason. And I think as a parent, so much we doubt our skills and we wonder, like, am I doing the right thing? Am I not doing the right thing? Did I make a mistake here? Should I have done this? And like I said, nature and creation has put that baby or that child with that parent for a very specific reason. And I think so often as parents, we should feel empowered by that and should really be, that you have the best intentions for your kid and you are doing the best that you can at that specific moment in time, and really take, I would say be proud of that fact and not doubt yourself, because I think so often we follow what our friend is doing or what our pediatrician said is the best thing to do, or, what Instagram follower says all the time. We see something, we're like, oh my gosh, I never did that. I should have done that. And, I think we should be just feel empowered by the fact that this is my kid. They're here for a reason. And I think we should be like, trust our guts, honestly, more than we do trusting everyone else's opinion on things. And what works for one family doesn't work for another family. So if you feel like you have made the right decision for your kid based on your specific situation and you're knowledgeable and you've looked into things, then you should be proud of that, instead of being like, oh, I should be doing what my neighbor's doing because they're doing a better job with their kids, or their kids are eating more organic than mine. I feel like being empowered is picking the things that you can do great as a parent and doing them. And, you're not going to be perfect. This is a journey. I think we're all learning. The way you parent your first is not the way you parent your second or your third. And how you parent your kid today is not going to be how you parent them tomorrow. That's just life. So I would say being empowered is being proud of, this is my kid and this is we ended up together for a reason, good, bad, or otherwise. And they came with their stuff and I came with my stuff, and we're going to figure it out together. So I would say that is empowered parenting. And the other side of that, I would say give yourself grace for the things that you can't always do great. I mean, you're always learning. We're always evolving.
Yeah.
And like I said, how you parent one child is not how you're going to parent your next child, or the choice you made today is not going to be the one you make tomorrow. So often I see in my practice, parents look back and they're like, I never should have done this with my kid, or I should have done this. And regret doesn't get you anywhere. I feel like we honestly, if that was the decision that you made at that moment and you thought it was the best choice for your kid, then that was the choice you made, and then move on. And if you need to change it, then change it. But be empowered by the fact that you are making the best choices for your kids at that moment and in time. So there you go. That's my empowered parenting.
I mean, part of learning is making mistakes, and that's where the best learning comes from, right? Is you made that mistake and then you learned the consequences of it. And then that makes it that much more personal to you when you learn how to do it.
Absolutely.
At a different way.
And that's how we grow as parents. Like, if you don't make a mistake, then you're never gonna get better, right? I mean, that's how you improve. So that's just part of how we evolve.
Yes. Yeah. And we should be proud of that. The mistakes are part of the learning process. It just means you're growing.
Absolutely.
You often work with babies experiencing feeding issues or birth-related tension. How does chiropractic care help support bonding and regulate the nervous system in those early weeks?
So, a chiropractic care, I'm going to take a step back and kind of focus on the nervous system. And that's where bonding happens, right? So, chiropractic care is so oftentimes people think of, oh, chiropractic is worried about back pain or posture or alignment. But chiropractic is also a major, and I would say even bigger part of that is the nervous system. And that's what chiropractic influences. So by adjusting the bones of the spine or adjusting the bones of the cranium or the skull bones, we're actually influencing the nervous system. And the nervous system is like your computer system for your whole body. It controls digestion, it controls respiration, it controls feeding, sleeping, all of those things. Your stress levels are controlled by your nervous system. Your immune system is controlled by your nervous system. So when there is dysfunction or we're not bonding is one of those things that happens because of your nervous system connection. When there is a misalignment in the spine, you're going to struggle to have that nervous system connection. And so there's lots of reasons why bonding can struggle. You can have a stressful delivery, you can have, some postpartum depression, you can have a baby that's really colicky, and all of those go back to the nervous system, right? So all of those things that I just listed are all nervous system regulated. And so when there is dysfunction or dis-ease there, that connection between parent and baby doesn't always happen. And then cortisol levels increase, and there's really dysfunction between that bonding experience. So there's lots of things that chiropractic helps, but bonding with your baby is such a vital, important part of wellness and development neurologically. And, we can go further on down that rabbit hole as far as like how that affects, future developmental milestones and being able to feed when you bond with your baby. But just the basics of that is getting your nervous systems in tune so that you can connect properly and you can bond as you go through go through those first couple months postpartum.
Yes, that bonding, when it's impaired, that is so stressful for both parties, like the baby and the mother. When that feeling that you're not doing it right because you're not bonding with your baby, that's hard. That's really hard, and that can put a lot of stress on everything, every aspect of your life.
Yeah, it, like I said, it stresses baby, it stresses mom, it stresses the entire family unit, and then everyone's nervous system gets fried, and it just continues, and that is also the imprint that we're putting on that baby at the beginning of their life, right? So their nervous system is being programmed for the rest of their life. And when we start out with a really stressful situation, and sometimes that's not controllable, sometimes it is, but it just affects the resting tone of how their nervous system is going to be. And that can be changed, that can be altered, but it takes work. It takes a lot of therapies, and it takes, a lot of work with other therapists and providers to be able to help that baby regulate their nervous system.
So when babies start out and their nervous system, the base of their nervous system is like fight or flight, or you're in alert mode,
yeah,
it's a hard place to start.
And, when we talk about fight or flight, the opposite of that is rest and digest. So that baby's not sleeping properly. There could be eating disorder. There could be gassiness or constipation. So they're stuck in that, that constant state of stress, which is, stressful to their little body and stressful to, mom's body and everyone in the family as well, for sure.
Yes. Yeah, that whole family unit. For parents new to chiropractic care, can you explain how adjusting the spine impacts the nervous system and how that relates to emotional or physical symptoms like colic and anxiety?
When a newborn baby comes in my office, oftentimes I'll do a full like oral exam in their mouth and feel for tension in their cranium or their cranial bones, and feel for tension in their mouth and their neck, because feeding is such an important part of what they do. That's what babies are born innately knowing to do. So we always do an assessment in their mouth to see if there's any tension orally. And oftentimes what I'll find is some tension in their palate or in the roof of their mouth. I think this is just a great picture of how connected the whole body is. So your vagus nerve, there's a branch of your vagus nerve, and there's a lot, everybody knows the vagus nerve is, fight or flight and anxiety and all of that. But your vagus nerve controls digestion. There's branches of your vagus nerve that control swallow and suck. And so vagus nerve is such a huge regulating nerve of your body. It's the longest nerve in your body. And so when there is dysfunction in one part of your nervous system, that can definitely cause symptoms like colic and anxiety. And then it shuts down your digestion, and it changes your respiratory rate and all of that. So when I go in the baby's mouth, oftentimes I find their palate is really tight, or their soft palate has got some pull to it. And one branch of the vagus nerve goes right through the soft palate and then goes down. And then, it connects later on to the rest of the vagus nerve and then goes all the way down to the stomach where it controls digestion. And so often when I'm doing work on a baby's head or cranium and I'm working on loosening up some of those cranial bones, it's amazing because there's just one little spot on that soft palate, and we just put a little bit of pressure there and we just kind of connect with that vagus nerve. So many times as the baby is laying there, they start tooting, there's gas coming out, and then all of a sudden they just have a massive bowel movement as they're laying on the table, which mom is like, oh my gosh, they haven't pooped in 3 days, this is amazing. And there's poop everywhere and it's great. But the point is that, all of that how intricately connected the body is, and just that little bit of pressure, you would think like there's a little spot on the palate that we can put a little bit of pressure and all of a sudden baby's pooping. Like, does that really make sense? It does in my brain, but it's amazing that your nervous system just controls everything. And so often a little bit of tension from a baby not feeding properly, and there's muscle tension on that soft palate. And as soon as we release that and we get their palate to soften out, now all of a sudden they're pooping, and there's gas moving through their body, and their body is now in a state of rest and digest, in a state of ease. And we've moved out of that like fight or flight where their body is just holding on to all that tension and they cannot get their body to regulate. So, it's amazing how just working on those specific structures can have such a huge influence on helping the nervous system regulate and helping babies heal and function. And any person, from baby to toddler to adult, being able to function well and their body be able to thrive and heal the way that was intended to work.
Yeah, like my baby, she's a thumb sucker. And so that kind of really, it emulates nursing, but it really makes sense that would soothe her.
Fire just puts pressure up there, and it's a soothing mechanism. It helps calm their vagus nerve. And oftentimes, you're exactly right. Kids that chronically thumb suck, there are speech therapists that refer kids to our office to be like, hey, you need to work on their palate because this kid is like 2 and their palate's really tight. And once we can get that to release, they're not feeling the need to constantly put that pressure on there as they're getting older. So it goes both ways. But yes, it's amazing how everything is so intricately connected. And even when you look at kids getting older too, it's like, I can't get my kid to stop thumb sucking. Like there's something wrong with my child. They keep thumb sucking. But it's like, if we take a step back and we look at the neurology and we're like, well, why is this child doing this? What is going on in their body? And figure that out, because no one just does things randomly. We all do things with an intention behind that. And kids are the same way. And so, when you bring up that point, it's like, oftentimes when we go back to the nervous system and to different things that they're doing, we can figure out like, hey, this makes better sense of why my child is doing this, which makes it easier to correct that behavior going forward.
Yeah. Because we say every behavior is a display of a need. It's not just a random inconvenience for some people, but it's like there's a need that they're trying to communicate through that. And you just have to get to the bottom of that to help adjust the behavior. Yeah. And I've also said that like with my daughter being a thumb sucker, my youngest son was also a thumb sucker, and he ended up having to have like dental work later on because of it. But I was like, I will pay for the dental work if it means that she can self-soothe now. We'll deal with the dental stuff later. That's fine. There are many misconceptions about chiropractic care for infants. What do you wish more parents knew about the safety and approach of pediatric chiropractic?
Pediatric chiropractic is very safe. There is, I would say, what most parents, pediatricians have in their mind about what happens during a chiropractic treatment or assessment and what actually happens are two completely different things. I have pediatricians that refer patients to my office, and then I have pediatricians that are absolutely appalled that kids come to my office. And my response is always like, come to my office and see what I do. Like, I promise it is not scary,
Yeah.
especially in a baby. There's no popping or cracking. We don't twist babies' necks. So their bones are not fused completely till they're about 7 or 8 years old. So there's very little stress that we need to, or impulse that we need to put into babies and kids' spines in order to get motion in those joints. The analogy that we typically use is we use about the weight of what you would use to check the ripeness of a tomato. That's how much force is going into their spine. Or in different areas, we'll use like an impulse to just create motion and to release the tension um, that is on the nervous system. So it's very gentle. I've been in practice for 16 years, and I've had many, parents come in very like, oh my gosh, I'm desperate. Like, please help me. I will do anything, but I'm really not comfortable with the fact that I'm in your office, but I'm here because I'm desperate. And I always tell him, like, please, like, I am not here to hurt anybody's kid. I am not here to cause trauma. Like, most kids leave my office with a sugar-free, dye-free lollipop with a smile on their face, and they're very happy. And most kids are very receptive to chiropractic care. I have patients that I've seen since they were little tiny babies, and they tell their parents, like, these are like 6-year-olds. They're like, hey, mom, I need to go see Dr. Rachael. And parents respect that there, and they say, okay. And they make an appointment, and then they come in, and I'll be like, oh my gosh, like something was really out in their neck, whether they were communicating like, hey, I have a headache and I'm not sleeping good, or they were just like, my body doesn't feel the way it's supposed to right now. I need to be adjusted. They recognize that, and they're so in tune with their bodies. So yeah, I would say, I promise it's not scary. Come visit if you want. I am always open to pediatricians coming to my office. And I always tell parents, if anything I do makes you feel uncomfortable, please tell me to stop. There's different things that we can do to treat your kid. And I always tell them, if it makes you feel uncomfortable, like, please tell me as I'm working on your kid to stop. And no one has ever told me, like, mid adjustment, to stop treating their kid. So in 16 years. So I feel like what we do is gentle. And like I said, if there's concerns, I love to talk about those before I treat a patient. But I feel like there's a lot of really scary images of what people think chiropractic care is and what it actually is.
Yeah. And just, I think, a gross misunderstanding of what role the nervous system plays in every other system that operates our body. What role does parents' intuition play in your work? How do you encourage families to trust their instincts when seeking care?
So I guess it's kind of what we were talking about before with empowered parenting. And I think it's just trusting your gut, and you don't agree with what one provider says. Like, you're the parent, the provider works for you. So if you don't, and that goes for chiropractic care, for if you don't like your speech therapist or your PT that your kid's working with and you're not jiving with them, then seek care somewhere else and trust your gut and do what's best for your child and your family, and be proud of that, because you don't have to just go along with things if you don't feel that they're helping your child, or you don't agree with the care that you're getting.
Yeah, I've met so many moms where I'm like, if you don't feel like your provider is listening to you, then go find someone else. Like, it's not the end of the line with that one person. You just need to find the person that is a good fit for you. Like you were saying, some pediatricians really are for chiropractic care, and some pediatricians are not for chiropractic care. Like, they're people too with opinions on what they think work best. And you just,
are they respectful of what you're doing as a parent? And I think that's where we can all disagree on, like, Do I think you should be, giving your kid Mountain Dew right before bed? Probably not, guys. I would say no. But you know what? Like, I can still respect you as a parent and still have a conversation with you and not be like, you're a terrible parent. You just gave your kid Mountain Dew before. Like, there's a difference there. And I think having respectful conversation with your child's provider is something that has been
Yeah.
lost in the past, I would say 10 years. I feel like, especially with COVID, I feel like everybody is just has their opinion and that's what it is. And I feel like we can still disagree on what we're doing here, but let's have an
Yeah.
honest conversation and be like, I don't think that's the best for your kid. You can do that. And I think this is what's going to happen. And then you can do this. And I think this is going to happen. And I feel like there's so much respect that we've lost for each other. And it becomes just this is the way it goes. If you don't like it, then leave my office or do this, or you're not following my care plan. And, sometimes it does need to, I guess, come to that if you're so far apart. But I think we can still have respectful conversations as providers and really appreciate that, we're
Yeah.
all in this together. We're all in this to try to help our kids and our families together. We're not fighting about this. This is our ultimate goal is the best for our child.
Right. Yeah. I've definitely noticed the lack of treating patients like they know something about what's going on. Like you come with a concern, and a lot of parents are getting dismissed instead of being like, oh, well, I am concerned about that as well. And here is why, or I'm not concerned about that. And here is why.
I think everyone's just gotten so opinionated with lack of respect. And I think parents are the ones that suffer the most from that
Yeah.
because it's like they really are trying to seek the best for their kid, but like you said, their concerns are just being dismissed and not like really sitting down and having a good conversation and talking about what's going on. The earliest I've ever adjusted a baby is a couple hours old. Like it's just a lot easier to
Wow.
check a baby and address things before they're like 6 weeks old. And now there's like all kinds of body tension and their nervous system is dysregulated and they're colicky. Whereas, a little bit of tension from birth in their occiput or the skull, where now, which can translate into disordered feeding, which can translate into neck tension, shoulder tension, body tension, slow digestion. If we had just adjusted that occiput right after birth, then we just, avoided a whole snowball effect of things further on down the roads. Oftentimes my pregnant patients ask me like, hey, when should I bring my baby in? And I'm always like, well, if there's something going on from like, if your baby had a really traumatic delivery or, not able to latch right from the beginning, please just call our office and get in like immediately. But otherwise, just go home and love on your baby and bring them in, a couple days or a week or so. I have some patients that stop by on their way back from the birth center or the hospital for their first check. And then others come in at like 1 or 2 weeks. But I believe all babies honestly would be benefit at some level from an early chiropractic assessment and treatment.
Yeah. I mean, birth is such a physically stressful situation for a baby. It
Yeah,
impacts.
for
I mean,
sure. I mean,
it would be
birth
hard
is
to imagine that it wouldn't affect them physically.
stress to the mom's body, and just as much, baby's feeling every ounce of pressure as mom is as well. So why would they exactly? Why
Yeah.
would they not need an adjustment?
What would you say to a parent who feels unsure about
Yeah, so
getting
I
their
think this
baby
goes
checked,
back to what we just
especially if
talked about
everything
too,
seems
is,
fine?
those little things, even though they're like, oh yeah, it's not a big deal at like week 1, by 6 weeks, it's causing a snowball effect. And, like I said, their neck is tight and their shoulders are tight and their digestion is slow and they're only pooping once or twice, a week. So I would say, if we can assess that baby early on and prevent that cascade of symptoms, then it creates a lot less stress on the family unit as a whole.
Yeah. Yeah. Nip that in the butt early on. Your clinic offers cranial sacral therapy and addresses concerns like oral ties.
I have had a cranial sacral therapist work with me since I graduated from chiropractic school. I've always had one in my office, and it is such a beneficial therapy. Cranial sacral focuses more on the soft tissue of the nervous system, the fascia, the muscles, and the delicate, the dura or the skin that surrounds the nervous system, the spinal cord and the brain. So where chiropractic focuses on like bony alignment, cranial sacral works more on the soft tissue or the fascia. I feel like they're both addressing the nervous system, just coming at it from a different aspect. And I honestly feel like the improvement that I see on babies or kids that are getting cranial sacral and chiropractic together is their adjustments hold for a longer period of time, but I also feel like they get better quicker for a lot of them. So that's why it's such a beneficial therapy that I love being able to offer in my office. I love being able to collaborate with cranial sacral therapists and work with them. That's always been something that I've really enjoyed in my office. And we see a lot of babies with oral ties. They benefit so much from cranial sacral. I mean, I see older kids with oral ties as well. I mean, I see kids all the way up into like teens getting their ties released. I saw it. I think an 80-year-old man get his tongue tie released at one point. So we work with ties are so I feel like ties can be a whole other podcast, but tethered oral tissue is something that it plays such a role in posture development, in nervous system regulation, in movement patterns. There's so many things that ties just plug into in our bodies, and being able to work with babies that are getting their ties released and then see the dramatic changes that occur in their, like I said, nervous system and in their just their ability to move and function is it can be sometimes really dramatic, and it's very exciting. So we love seeing babies with tethered oral tissue and helping play a role in getting them on the path to wellness as well.
Yeah, my daughter has a tongue tie, but we haven't really done anything about it.
I mean, most parents are like, oh my gosh, I'm coming here with my 5-year-old. I just realized they had a tie now, and now we have all these issues. And I'm always like, well, I saw an 80-year-old man get his tongue tie released. So you are way ahead of the game. You are never too old to get your tongue released. Absolutely.
Yeah. Yeah. I mean, it would benefit anybody at any point in time. So how does nervous system health impact older children as they grow, especially when it comes to focus, behavior, and emotional regulation?
So when we talk about, when we were talking a little bit about the vagus nerve before and colic, I feel like that goes right back into just anxiety and stress and ADHD symptoms, because those are all the same symptoms of colic, just in a toddler or in a 5-year-old or a 10-year-old. So often getting the spine adjusted and being able to, connect with the nervous system on that deeper level can really help regulate a lot of those things. And that goes for adults too. I mean, there's plenty of patients with anxiety that come in our office, and they just getting their body adjusted can help, make a huge difference in how their nervous system functions and is able to handle stress. No.
Yeah, because it's not like the vagus nerve goes away.
Yeah, nothing in your health
like,
ever goes away. You either just ignore
by everyday
problem later on, or you take care of it and it can get better. Yes.
Yeah. It's like you either learn to pay attention to it and treat it, or you learn to ignore it and it just gets worse. Can you tell us more about what services you offer and who might benefit most from working?
Her name is Bethany Troklish. You can find her on findingtheroot.com. She is amazing. I love being able to work with her. It's always wanted to have a naturopath in my office, and finally this year Bethany fell into my lap. So I love collaborating with her. Her office is right next to mine. I pick her brain all the time. She's wonderful. So Bethany offers some naturopathic care. Like I said, we have cranial sacral, chiropractic. We offer nutritional advice. We carry a wide range of supplements, probiotics, and some naturopathic things. So, any support that we can help to give a family and kids, moms, everybody, to help support them in their journey of health.
Yeah. It sounds like you offer a full spectrum of healthcare. So that's fantastic. Where can listeners go to book an appointment or follow your work on
Dr. Kuperus, DrKuperus. Everybody spells my name wrong. drkuperus.com. You can follow me on Facebook or Instagram. Rachael Kuperus DC is my Facebook page, or my Instagram is Rachael Kuperus as well. So you can follow us on Instagram. You can call the office to schedule an appointment. Our number's on our website, but we're just, any way that we can help, we're happy to do so.
Well, thank you so much, Dr. Rachael, for being on the show today. I really enjoyed talking to you and letting our listeners know more about what you have and all the crazy things that chiropractic care can do. All right. Thank you all. Until next time.